Dr. Maria Rossi, a family medicine physician, is joining us. Thank you for being with us.
Thanks for having me.
When it comes to colorectal cancer, there are often those preconceived notions or fears that people might have. We're hoping that you can talk through some of those fears for us and just give us some information.
Yeah, absolutely.
Alrighty, let's take a look at our very first one here. It says, there's nothing I can do to prevent colorectal cancer.
Yeah, and I would say that's not true. Key things that you can focus on to decrease your risk for colon cancer: eating a healthy diet, which often includes high fiber, plenty of water. We recommend up to 40 to 64 ounces a day, as well as exercise. Also avoiding things like cigarettes and smoking, right? And alcohol use, and also getting plenty of rest. Those things can all be helpful.
Okay. Our next one, it says, I'm way too young to worry about colorectal cancer.
Yeah, again, that's something that is not true. While colon cancer only really occurs in about 25% of family members, its risk is still high enough where you should be concerned about it. So if you do have a primary family member that's developed colon cancer, your risk is greatly increased. So you should worry about it at a young age.
Okay, so really that age, portion isn't true anymore.
True, yes.
Right, all screenings are the same. It doesn't matter which I choose.
That is also not true. There's 3 primary options that we offer right now for colorectal cancer screening. One is called the FIT test, and what we do is we do a stool test that you bring into the office, and we look for blood. If blood is present in there, then the recommendation is to do a colonoscopy. The second one is a Cologuard test, which does look for DNA of cancer cells. It also looks for blood. And then, of course, the last option is the colonoscopy. The colonoscopy is considered the gold standard for a colorectal cancer screen, because if there was a small polyp or an early colon cancer that was found, it could be identified and taken care of at that moment to prevent further concerns or further procedures later on.
Okay, so colonoscopy, gold standard.
Gold standard, you got it.
Alrighty. The colonoscopy prep is so awful and the procedure sounds scary. I just can't. What's your reaction to that?
Yeah, it comes up quite a bit. There's multiple options for prep that you can talk to the endoscopist about. Things that include everything from just a few tabs with 64 ounces of water to lower volume preps. The only thing you'll have to be cautious about is insurance coverage when it comes to the less volume preps.
I mean, the really important thing is just getting the procedure done, right?
Exactly.
All right, Dr. Rossi, thank you so much for being with us and providing all this great information.
Yeah, no problem. Thanks for having me.